We're working with Canada and Mexico to prevent the spread of the virus across North America very closely. This is a joint comprehensive effort in collaboration with our neighbors. The measure and all of those measures that we're putting in place will protect the health of all three nations and reduce the incentive for a mass global migration that would badly deplete the healthcare resources needed for our people. And so we are working very closely with Mexico, very, very closely with Canada. The relationship's never been better. We're all working toward the same goal. Our nation's top healthcare officials are extremely concerned about the grave public health consequences of mass, uncontrolled cross-border movement. And that would be mostly, and even beyond, but mostly during this global pandemic. Every week, our border agents encounter thousands of unscreened, unvetted, and unauthorized entries from dozens of countries, and we've had this problem for decades. For decades, you know the story, but now it's with the national emergencies and all of the other things that we've declared, we can actually do something about it. We're taking a very strong hold of that. And we have before, but this is now at a level that nobody's ever approached. In normal times, these massive flows place a vast burden on our healthcare system. But during a global pandemic, they threaten to create a perfect storm that would spread the infection to our border agents, migrants, and to the public at large. Left unchecked, this would cripple our immigration system, overwhelm our healthcare system, and severely damage our national security. We're not going to let that happen. To confront these public health degrees, the Centers for Disease Control and Prevention has decided to exercise its authority under the Title 42 of the U.S. Code to give Customs and Border Protection the tools it needs to prevent the transmission of the virus coming through both the northern and the southern borders. So we're treating the borders equally, the northern border and the southern border. They're both being treated equally. A lot of people say that they're not treated equally. Well, they are. As we did with Canada, we're also working with Mexico to implement new rules at our ports of entry to suspend non-essential travel. These new rules and procedures will not impede lawful trade and commerce. Furthermore, Mexico is taking action to secure our own southern border and suspend air travel from Europe. So we're coordinating very closely with the air travel going to Mexico and then trying to come into the United States. The actions we're taking together with our North American partners will save countless lives.
Under the President's leadership this week, we've taken two important steps. First, as President Trump announced on Wednesday, the United States and Canada jointly agreed to restrict all non-essential traffic across our border. This decision goes into effect tonight at midnight. The restrictions will be reviewed after 30 days, and they exclude traffic and movement across the border for work or other essential reasons. We're grateful to have such an outstanding friend to the north who is committed, as we are, to defeating this virus. I also want to announce today that the United States and Mexico have agreed to restrict non-essential travel across our shared border. Both our countries know the importance of working together to limit the spread of the virus and ensure that commerce that supports our economy continues to keep flowing. Here, too, the United States is glad to have a friend who's working side by side us in the fight. On another note, yesterday the State Department issued a Level 4 global travel advisory. This means that all international travel from U.S. citizens should be avoided. In countries where commercial departure options remain available, U.S. citizens who reside in the United States should arrange for immediate return to the United States unless they're prepared to remain abroad for an extended time. If you choose to travel internationally, your travel plans may well be severely disrupted.
As we continue to evaluate common sense measures that reduce risk and prevent further spread, it only makes sense that we have looked at the measures that our neighbors to the north and south are undertaking. And so we've been working closely with those partners since the earliest days of this virus and the outbreak. And again, as the President said earlier this week, and Secretary Pompeo, we've reached an agreement with both Canada and Mexico to limit non-essential travel across our land borders. Let me be clear that neither of these agreements with Canada or Mexico applies to lawful trade or commerce. Essential commercial activities will not be impacted. We will continue to maintain a strong and secure economic supply chain across our borders. A few examples of essential travel include, but certainly are not limited to, individuals traveling for medical purposes, to attend educational institutions, for emergency response, public health services, and individuals engaged in lawful cross-border trade. As the Secretary said, the agreements with both Canada and Mexico will go into effect on Saturday, March 21st. Furthermore, we're also working collaboratively with Canada and Mexico to take decisive joint action regarding individuals seeking entry between our ports of entry. The CDC order directs the Department to suspend the introduction of all individuals seeking to enter the U.S. without proper travel documentation. That's for both the northern and southern border. The CDC director has determined that the introduction and spread of the coronavirus in the Department's Border Patrol stations and detention facilities presents a serious danger to migrants, our frontline agents and officers, and the American people. So it's important to note that the Department currently apprehends foreign nationals from over 120 different countries around the world, the vast majority of those having coronavirus cases. Many of these individuals arrive with little or no identity, travel, or medical documentation, making public health risk determinations all but impossible. It's also important to note that the outbreak on our southern border would likely increase the strain on health systems in our border communities, taking away important and life-saving resources from American citizens. Tonight, again at midnight, we will execute the CDC order by immediately returning individuals arriving without documentation to Canada, Mexico, as well as a number of other countries without delay. And so, again, CBP is positioned to execute these measures as we continue to keep our borders secure and safe.
Under Section 362 of the Public Health Service Act, the CDC is suspending the entry of certain persons into the United States because of the public health threat that their entry into the United States represents. This order applies to persons coming from Mexico and Canada who are seeking to enter the country illegally and who would normally be held in a congregate setting like a Customs and Border Protection station. It does not apply to U.S. citizens or lawful permanent residents. During this pandemic, a number of health challenges arise when illegal immigrants arrive at our northern and southern borders and are taken into immigration custody. We're talking about significant numbers of illegal immigrants. From this past October through February, DHS has processed more than 21,000 inadmissible aliens at the northern border and more than 151,000 inadmissible aliens at the southern border. CBP facilities were never designed to hold large numbers of people and to protect agents and migrants from infection during a pandemic, nor to treat them for a novel virus if large numbers are infected. When held at border facilities, these migrants risk spreading the virus to other migrants, to CBP agents and border healthcare workers, and even the United States population as a whole. In such circumstances, the kind of social distancing measures the CDC and the President have recommended are simply not possible. On top of that, any resources that we are using to reduce the risk of infection among CBP agents, healthcare workers, and migrants in these facilities are drawing on an American healthcare system that is already fighting the coronavirus pandemic. That's why the President and his administration are taking these important steps to keep Americans and our immigration system safe from these health risks as part of our whole-of-government approach to combating the coronavirus.
Just on illegal entries of people who are OTM, how will the turn-back process work? Will they be taken to a common area and then put on a plane and sent back to northern countries or others? I mean, how would that process work?
Again, it's a public health crisis, so what we're trying to do is limit the amount of contact that we have with these individuals, not putting them in Border Patrol facilities, ICE detention facilities, and the like. So it's going to be very rapid. We're going to obviously take them into custody and then send them back to a port of entry or other means. So it'll be very quickly. It won't be the 6 or 7 or 10 days that we currently have. It'll be much more rapid.
But if they are OTM, will they be taken to an airfield nearby?
That's correct. That's correct.
And sent back to
Absolutely.